Michael Swango. Graduated from Southern Illinois University School of Medicine in 1983. He finished near the bottom of his class. Multiple supervisors during his residency had filed complaints. Nurses at Ohio State University Medical Center had reported watching him inject patients with unknown substances shortly before those patients died unexpectedly. One nurse described watching him enter a patient's room, inject something into the IV line, and leave. The patient was dead within the hour. The hospital investigated internally. They found the complaints credible enough to restrict his access. Then they quietly allowed him to complete his residency anyway. Nobody called the police. Swango moved to Quincy, Illinois, and got a job as a paramedic. Within months, 5 of his colleagues became violently ill after eating food he had prepared. They survived. Swango was arrested, convicted of aggravated battery, and sentenced to 5 years in prison. He served 2.5 years. When he was released, he applied for medical positions again. The American Medical Association database listed his poisoning conviction. Multiple hospitals checked his references. Several called Southern Illinois University directly. The university confirmed his degree. Nobody mentioned the nurses' complaints. Nobody mentioned the patients who had died during his residency. The information existed. It was documented. It sat in files that nobody forwarded. Swango was relicensed in Virginia. He got a residency position in a New York hospital under a false name. He was eventually caught falsifying his application and dismissed. He got another position in South Dakota, dismissed again when his background was discovered. He got a position in Zimbabwe, then Zambia. In Zimbabwe, patients under his care died at a rate that colleagues noticed and documented. Local nurses nicknamed him Doubling Doctor because the death rate on his ward doubled when he was on shift. Hospital administrators wrote reports. The reports were filed. He was eventually arrested in 1997 at Chicago O'Hare Airport, attempting to board a flight to Saudi Arabia, where he had accepted another medical position. Federal investigators linked him to the deaths of at least 4 patients in the United States and an unknown number in Africa. Some estimates put his total victim count above 60. He pleaded guilty to 4 counts of murder. He was sentenced to life without parole. He is currently serving that sentence in a federal prison in Colorado. The nurses who reported him at Ohio State in 1983 were never formally acknowledged. The hospital that ignored their reports and quietly graduated him anyway has never been held accountable. The system that allowed him to keep practicing across 4 countries over 14 years was not a failure of information. Every institution that hired him had access to the truth. They chose not to look.
Shipman.
Harold Shipman was a family doctor in Hyde, Greater Manchester. He was well liked. Patients described him as thorough, attentive, and caring. He made house calls. He remembered names and details. He was the kind of doctor people requested by name and felt fortunate to have. Between 1975 and 1998, he killed at least 215 of them. The method was consistent. Shipman would visit elderly patients, predominantly women living alone, administer a lethal overdose of diamorphine, and then certify the death himself. Because he was the attending physician, because the patients were elderly, and because the cause of death was recorded as natural causes by the very man who had caused it, nobody looked twice. He nearly got away with it entirely. In 1998, a local GP named Dr. Linda Reynolds noticed something. She had been referring patients to the local coroner and had begun tracking death rates across local practices. Shipman's patients were dying at a significantly higher rate than patients at any other practice in the area, specifically elderly female patients, specifically when Shipman had visited them that day. She reported her concerns to the coroner. The coroner reviewed the cases and found nothing actionable. The matter was dropped. 3 months later, Shipman forged the will of his final victim, Kathleen Grundy, an 81-year-old former mayor, leaving her entire estate to Shipman himself. Grundy's daughter, a solicitor, found the will suspicious and contacted police. Grundy's body was exhumed. The post-mortem found a lethal concentration of diamorphine in her tissue. Shipman was arrested. The investigation that followed was one of the largest in British criminal history. It eventually concluded that Shipman had killed at least 215 patients. The actual number is believed to be higher, possibly above 250, making him the most prolific serial killer in recorded British history and almost certainly the most prolific medical killer in modern history anywhere in the world. The Shipman inquiry, led by Dame Janet Smith, spent 4 years reviewing every aspect of how he had operated undetected for over 2 decades. Its findings were precise and damning. The death certification system had no mechanism for detecting a pattern of deaths attributed to a single doctor. A doctor could certify their own patient's death with no independent review unless the coroner was specifically notified, which required someone to raise a concern, which almost never happened when the certifying doctor was trusted and liked. The controlled drug monitoring system had a gap large enough to drive through. Shipman had been overprescribing diamorphine for years, stockpiling it from patient prescriptions that were never fully used. Nobody monitored the accumulation. Nobody cross-referenced prescriptions with patient outcomes. Dr. Reynolds had noticed. She had reported it. The coroner had reviewed it and found nothing. The inquiry found that the coroner's review had been inadequate, that if a proper forensic review had been conducted at that point, Shipman's final victim, Kathleen Grundy, would still be alive. On January 13, 2004, Harold Shipman was found hanging in his cell at Wakefield Prison. He was 57 years old. He never confessed. The full extent of his killing was never established. The exact number of people he murdered will never be known. His medical license had never once been suspended.
Farid Fata. On August 6, 2013, a whistleblower named George Karadesh walked into the FBI field office in Detroit and told an agent that his employer, oncologist Dr. Farid Fata, was administering chemotherapy to patients who did not have cancer. The agent took notes. An investigation was opened. What investigators found over the following weeks was worse than Karadesh had described. Fata ran a cancer treatment network across Michigan Hematology Oncology, with multiple clinic locations and a patient list that ran into the thousands. He had been in practice since the late 1990s and had built a reputation as one of the most respected cancer specialists in the state. He drove a Rolls-Royce. He was invited to medical conferences. His waiting room was always full. He was billing Medicare for treatments his patients did not need, and in many cases were actively harming them. Patients who came to him with fatigue or minor blood abnormalities, conditions that required monitoring or mild intervention, were told they had cancer, specific serious named cancers. They were presented with treatment plans. They were started on chemotherapy. Some of them did not have cancer at all. Others had cancers that were in remission and required no treatment. Others had conditions that were being overtreated at doses and durations far beyond any clinical justification. Fata administered unnecessary chemotherapy to at least 553 patients. Some received it for years. Chemotherapy destroys healthy tissue. It causes permanent nerve damage, organ damage, immune system damage. It causes secondary cancers. It is one of the most physically destructive treatments in modern medicine, justified only when the alternative is worse. For hundreds of Fata's patients, there was no alternative. There was no cancer that needed treating. There was only a doctor who had calculated that a frightened patient would not question a diagnosis, would not seek a second opinion, and would trust the man in the white coat who used the word oncologist on his door. Several patients died. Investigators and prosecutors later argued that some of these deaths were directly caused or accelerated by the unnecessary treatment itself, bodies destroyed by chemotherapy they should never have received. Fata was arrested in September 2013. He pleaded guilty in 2014 to 13 counts of healthcare fraud, 1 count of money laundering, and 2 counts related to illegal administration of controlled substances. At sentencing, patients testified, dozens of them. They described losing their hair, their jobs, their relationships, their physical capacity for a cancer they never had. One man described spending 3 years believing he was dying before discovering he had been healthy the entire time. Fata was sentenced to 45 years in federal prison. He will be 91 years old at the earliest possible release date. His clinics had been inspected. His billing had been audited. Medicare had flagged anomalies in his reimbursement claims in 2010, 3 years before Karadesh walked into the FBI office. The flag generated a review. The review was administrative. Nobody called his patients. Nobody reviewed his diagnoses. The anomaly was processed as a billing irregularity, and the file was closed. 553 patients, 3 years, 1 administrative flag that went nowhere. It took a single employee who could no longer watch it happen to walk into a federal building and say what he had seen.
Christopher Duntsch in 2011 completed his neurosurgical training and began operating on patients in Dallas, Texas. He had a PhD in molecular biology alongside his medical degree. He was articulate, confident and persuasive. Hospital administrators described him as impressive in interviews. Patients described him as reassuring and certain. In his first 19 months of practice, he operated on 33 patients. 17 of them were seriously injured. 2 of them died. The injuries were not the kind that result from surgical risk, the understood and disclosed possibility that complex procedures can go wrong despite a surgeon's best efforts. These were injuries that other surgeons who reviewed the cases described with words like inexplicable and anatomically incorrect, nerves severed that should have been preserved, surgical instruments left in the wrong position, tissue damaged in ways that indicated the surgeon had been operating in the wrong location. One patient, a 56-year-old man named Barry Morgoloff, went into surgery to relieve chronic back pain. He came out paralyzed. Another patient, a 74-year-old woman named Kelly Martin, died on the table during what was described as a routine procedure. After each incident, Duntsch moved hospitals. When one facility suspended his privileges following a patient death or serious injury, he would apply elsewhere. He wrote letters of recommendation for himself using colleagues' names. He called administrators at new hospitals and described his record in terms that bore no relationship to what had actually happened. And the hospitals hired him, not because the information about his patients wasn't available. In Texas, the state medical board requires hospitals to report serious adverse events. The reports had been filed. The medical board had received them. The board reviewed the complaints and took no action. Duntsch continued operating. It was not regulators who stopped him. It was 2 other surgeons, Dr. Robert Henderson and Dr. Donald Moss, who had been called in to perform emergency corrective surgery on Duntsch's patients and had seen the damage firsthand. They filed complaints, wrote letters, contacted the medical board directly and demanded action. The medical board's response was to send Duntsch a letter asking him to take a continuing education course. Henderson and Moss escalated. They contacted prosecutors directly. They argued that what Duntsch was doing was not malpractice, it was assault. In 2017, Christopher Duntsch was charged under a Texas law specifically amended to address his case, a law making it a felony for a medical professional to intentionally cause serious bodily injury to an elderly patient. He was convicted on 1 count of injury to an elderly patient. He was sentenced to life in prison. 33 patients, 17 serious injuries, 2 deaths, 19 months, multiple hospitals, multiple medical board complaints. The system designed to stop him filed the paperwork and moved on. It took 2 surgeons who refused to stop making noise to put him in a cell. 4 doctors, 4 completely different methods, 4 completely different countries and systems and time periods. The same pattern. In every case, someone knew. A nurse filed a report. A colleague noticed the death rate. A whistleblower walked into a federal building. 2 surgeons wrote letter after letter after letter. In every case, the institution that received the information processed it and moved on. Swango's nurses were ignored in 1983. Shipman's anomaly was reviewed and dismissed in 1998. Fata's billing flag was closed administratively in 2010. Duntsch's medical board received multiple formal complaints and sent him a letter about continuing education. The information was never the problem. In each of these cases, the patients who were harmed after the first warning had already been given, they were not victims of a hidden predator. They were victims of a system that had been told exactly what was happening and had chosen, for reasons of institutional convenience or liability or simple bureaucratic inertia, not to act. The doctors in these stories are in prison or dead. The systems that enabled them are still running. If you enjoyed this video, subscribe for similar ones and feel free to drop suggestions for the next video in the comments.